Okay. Hi, good evening to everybody and welcome to this week's Maternity and Midwifery Hour. This is, according to my thing, session 12, but I know it's been advertised as session 11, so I'll allow that one. I'd like to welcome everybody to this hour. My name's Sue MacDonald and I'm the curator for the Midwifery Festivals and for these hours. And these hours were specifically designed, and forgive me those people who've come in before, but these were designed to provide continuing professional development for midwives, student midwives, people who want to become midwives, and other people who are interested in maternity care. And they come via Matflix, which is a fantastic video streaming from maternity experts and a fantastic source and a resource for any midwives who are actually looking at their revalidation. I feel delightfully smug because I've just done my revalidation, so I was able to get a lot of information, which was absolutely fantastic. So we really were keen for these hours to be a way of getting contemporary information, quite a bit on COVID, as those of you who've come in before will know, because that's what's on our mind at the moment, whether we try and escape or not. And I am so delighted to be joined by two wonderful people this evening. So I know you're going to have a fantastic evening, and that's Clare Raynor and Elaine Hanzak. And here they are in all their glory. We're going to be discussing long COVID, lessons for midwives. In a way, you can say lessons for midwives, information for midwives, certainly. Now, we always start with a little moment of the week just to lighten the kind of atmosphere and get people thinking positive as well as more challenging material. So perhaps, Clare, would you be able to share your moment of the week?
Yeah, my moment of the week was I don't have children myself, so my nieces are my surrogate children, and my 14-year-old niece, well, she just turned 14, and I saw her opening her presents on FaceTime, and I hadn't seen what I'd got her because somebody else had ordered it, and she'd asked for a crescent-shaped mirror, and she just opened it, and her face was so delighted. So that was my moment of the week, and also not just to see her happy, but to see her develop as thinking, oh, she wants that for her room. She's got an idea. I really like that.
Fantastic. She sounds like she might be one of these interior decor people in the future, maybe.
It's looking like that.
Fantastic. Thank you for that. How about Elaine? I know you had an interesting one too.
Yes, I think, like probably many of us, I confess to a little bit of daytime TV. And
No.
I know, scandalous. And I happened to catch one of the episodes of Tipping Point, and there was a lady on with red boots. And I remember I looked at them and I sighed and I thought, oh, they're just like the ones that I have that must be dusty at the bottom of the wardrobe. Mm-hmm. Because as you will hear, it's been many months now since I wore anything on my feet other than slippers or trainers. And the thought then suddenly crossed my mind that along with the great news about the vaccination, that wow, just maybe soon the red boots might re-emerge. And it filled my heart with joy.
Wonderful. Well, I like to think the red boots will come into their own. Yes. That's a very positive. Thank you so much for sharing your positive moments, because these are difficult times, and everyone knows that. Most of the UK is under different tiers. Some of you will be under 3, some of you will be 2. If you're lucky, you're under 1, so you can communicate more with the people around you. But we're looking at Christmas, and there's going to be a few little bit more flexible arrangements. You must follow your instructions though, and if you haven't got the NHS COVID app, it's worth getting that just to keep a check on what your local arrangements are. And also you are meant to check in whenever you go in somewhere with your little phone. I've just got used to doing the scanning bit myself, and it's very magical. And that's meant to make sure that you're told if you come in contact with anywhere where there might be COVID infection and what to do then. So it's useful doing that. Now we know that the intensive care units and high dependency care units are still busy, and we send out thank yous, big thank yous and love and good wishes to all the staff who are keeping that going. We all thanked them in the spring. They're still there and they're working their socks off to look after people and make sure that the care is exceptionally fantastic for our people, for people who are sick, our relatives and our friends. So thank you to those people and keep it up. And we love you. We love the NHS. We just love it. It's the best in the world. No question about that. And we also actually need to give a big virtual hug to our people in maternity care, because they're not doing necessarily the COVID care, but they're making sure the service keeps going. They're making sure women and their babies are cared for and given information and looked after. So also a big thank you to them. We know you can't cancel childbirth and pregnancy, and people are scared. And so we need to make sure they're cared for. And for anyone, and that's especially relevant to this evening, we want to spend special love and care to the people who are going through either COVID or the after effects of COVID or long COVID. And we're going to hear more about that and how to help people who are experiencing that. And you may have people in your family, you might yourself have been suffering, and I hope this will be really helpful. So, and the final big thank you is to all the key workers, everybody who keeps the place going, and that's from the shop people to the transport to the rubbish, refuse collectors, everybody who keeps everything going. We mustn't take it for granted, because they're doing their bit to keep everything going for us. Now, of course, the big news this week, big news, is the Pfizer vaccine has arrived and is being distributed and given to those primarily at the moment over 80, plus home care workers and frontline NHS staff at the moment. It's obviously going to take quite a long time, but it has been. And I think anyone who's watched the footage on the news will have been as heartened to see those people getting their vaccinations and how positive that is for the future. So we're all going to get access to these vaccinations. It's going to take a while, but it's great to see it being rolled out. Fantastic. Okay, other news for us. December is Human Rights Month, an important area we need to think about. And it's also, this week is National Grief Awareness Week. And some people will have heard people talking more on the radio, on the TV, about loss and grief and how they're dealing with it, and kind of being very aware that grief doesn't get sorted out within, you've dealt with losing someone, you just get on with life. We know that, and we need to really focus on that. So have a look at some of the resources to get more information on that. It's also International Anti-Corruption Day. I don't quite know what we do on that day. Probably try not to be corrupt. That would be a good place to start. I was also noticing there's a very interesting campaign from the Rosie in Cambridge called Ditch the Doppler. Yeah, I noticed it particularly this morning, reminding women to be very aware of their baby's movements. I think there's a big move for women to be using these wee Dopplers, either with their phones or whatever, to listen to their babies, which can be nice, but also they need to remember to be aware of their baby's movements, because babies each baby has a personality of his own, and only the mother will know that personality. And the idea is if you have any concerns, is to call your midwife and have a discussion with that midwife about the quality of your baby's movements. So I'm sure that will be backed up by a lot of people within the UK. Also, the Embrace launches this week. So that's the confidential inquiries. That's online on the Thursday and 10th and 11th for those of you who can have some time to be on the online activity. And I think that's the news for today, because I'm going to go and say hurrah for the vaccine away again. Do check out the resources page, which will be available online. We've got lots of resources on there from both our lovely speakers to access. So you don't have to scribble down references, they'll be there. Also remember, because this is being recorded, if you don't catch something, or you want to have more highlights, or you want to watch the whole thing again, which you might well want to do or share with your colleagues, you've got access after, I think it'll be Friday, it'll be available to you. So that's fantastic. Okay, so we're going to have a discussion this evening on long COVID, and we've looked at the issue of COVID over the last few months on the maternity services, on how we've cared differently for the women and babies, but also how the illness impacts on people, patients themselves. And we're going to look at long COVID, which I understand can sometimes follow COVID itself, but also can be a kind of entity in itself. But I know we're going to learn more from our speakers this evening. We have, first of all, Clare Raynor, who is a consultant occupational physician. She's retired and no longer practices clinically, but she has done a 6-month obs and gynae job during her GP training in 1995. She also works as an artist after retiring from clinical practice on health grounds. So she keeps very close to health, which is fantastic. She's also a trainer, communication skills for healthcare professionals. She's worked on the National Education Project for Health and Work and was an honorary lecturer at the Centre for Occupational and Environmental Health at the University of Manchester. She has had long COVID herself, and she's spoken and written about it. And currently she's working with UK doctors and patient groups to develop appropriate health services for long COVID patients, because I think you'll see from when she talks, this is going to be a really important part of care on the ongoing months and years to come. She's also collaborating with the Department of Rehabilitation at Mount Sinai Hospital in New York. So she's truly a not just national treasure, but an international one. So welcome to us, Clare, and the screen is now yours.
Thank you very much. What a lovely welcome. That's so kind. Whilst I share the screen, I'm just going to tell people how I came to be asked by you to do this. And lovely. I have a very good friend called Dr. Amali Lokigamage, who I went to medical school with, and we shared a flat. And over the last few years, we've been collaborating together, me illustrating her second book, which is going to come out soon. We're waiting until we feel a bit calmer after some of the stuff to do with COVID has settled a bit, because it is about trying to find stillness through the sort of lens of maternity and childbirth and creativity. So I've just put a little picture of the baby that I drew for the front of the book, because I love that little baby. I don't know why, but I just do. So that's how I come here today. It's an unusual way, and it seems like a lovely setup. So I'm glad to just be able to share what I know. One thing has led to another with long COVID. I never would have imagined talking to anyone on the news or anything like that. But here I am, and I just feel very passionately for all the people that have been affected, really. So I'm just going to move my slides on. So yes, that's going to be the front cover of the book we've done together. And I think Amali also coined this beautiful phrase when we were talking. Well, it's a useful phrase. We were ill exactly the same time with COVID from mid-March, literally followed the same patterns. And the symptoms have been weird. And we recognised, well, she said they're remarkably similar, though bizarre. But she wasn't just talking about me and her. She was talking about all the other people we were starting to hear from. And we were kind of thinking also it's a sort of relapsing condition. That was also bizarre about it. You'd think you got over it, and then you get hit again. With my slides, there's quite a lot, and I haven't done them so that I'm going to talk through every detail of them. I know that some people like to have them to look back on, and so I have put references and stuff there. I think the first question is really, what is long COVID? And I'll give you some of what people are saying. So there's a professor of general practice called Trisha Greenall, who I've met, fabulous character. She really wrote the first all-encompassing article really about what long COVID was, but she did it because she talked to a lot of us. So she did a lot of interviews with us, and we were able, not just doctors and so on, but people with prolonged symptoms. And so she suggested in her paper that there might be 3 phases to a COVID infection. One being the acute phase, which, you could roughly say might be 3 or 4 weeks. She then suggested that the sort of intermediate phase between 4 weeks and 3 months you might call post-acute. And then anything after that she called chronic. Now, I think this is quite a good category because it does describe the timescales of things. But what we now know is 9 months on from when a lot of people contracted it, it's going on and on for a lot of people. So she doesn't say it's a perfect definition, but she tries to say, look, at least we have some phases we can help people to sort of work out, the doctors to work out what's going on. The reference is there. And she wrote a second paper where she'd done a lot of qualitative interviews with 114 people with long COVID, and these were wonderful. It was the first time I think some of us felt heard. And we were able to say, actually, this is not just a post-viral thing. It's not just fatigue. We've got organ damage, and most of us haven't been to hospital. We haven't received any care. So she just transcribed what we said, but that as well has been quite a game-changing article, I think. Then we linked up with a really lovely lady called Professor Lynn Turner-Stokes, who's a rehabilitation specialist, who just gets her head down and works. So she doesn't really respond to emails, but she's been in the thick of it. And I have put there a couple of links to some YouTube or webinars that she's done. She says it all. She says it all. And in one of them, she says it all in the first 10 minutes. She explains what she thinks it is. Now, she says that all the symptoms that people describe within long COVID are directly due to the virus themselves. This is not post-viral fatigue, she said. So she's that was really interesting, and I think I agree with her. The British Society of Immunology has put out a really useful shortish paper, which I think I have referenced, or you could easily look up with this. And they've said, look, we've got to look into what's causing these problems in these people. The three main theories that a lot of people are now looking at are, is there any reservoir of virus hanging around that sometimes is rearing its head again? That hasn't been ruled out, and it hasn't been ruled in, but I think there are a number of people that may be happening. You'll have heard about the inflammatory response that people are getting. That seems to be a big part of it. All of these looking into. There are theories about viral infection triggering new autoimmune disease, and quite a few people have developed new onset diabetes or new onset autoimmune thyroid problems. This is really common. And I'm sure that you already know that people can develop clots. So there's all that going on. And then there's been things about children having a multi-system inflammatory syndrome, which is quite serious, but I think they're now finding that adults could have that as well. So I'm really skirting over some of the possible causes, but they're all up for research really. And those top three are the main ones. I've put pregnancy down as a question mark because I personally am not able to tell you too much about how women's bodies react if they have COVID during pregnancy, and I suspect you will have more knowledge on that than me. So what do I conclude after all these months? What is long COVID? I conclude that all we can say at the moment is it is symptoms of COVID-19 infection that last more than 3 or 4 weeks, because we do not know yet what is going on for us that have had the duration. So I think that's what we have to be careful of, not assuming it's post-viral fatigue or any one thing, because I think it's complicated. And I've put down it's not one thing. And I think we should take each person and look at them as individuals. What is going on in this person? What are the factors there? I've put in bold there, you do not need a positive test to be diagnosed with COVID. I'm hoping this is old news, but I don't think it is, because many doctors and healthcare people are still saying, but you didn't have a positive test. we know for several reasons that they either weren't available or actually they're not that accurate. So I think that's just never say to a patient or a person, but you didn't have a positive test, because it's now been debunked. And the World Health Organization have set out criteria for how you can diagnose it clinically, which is what we should be able to do anyway. So it is a multi-system disorder. It's primarily a disease that infects the blood vessels, not the lungs. It just isn't primarily a lung disease. And I think that's probably what people got wrong in the first place. It infects the blood vessels, the really small blood vessels. I can hardly say this word endothelitis because I've never heard of it. So I think it means the tiny little blood vessels get infected. But I think that if it's a blood vessel infection, then no wonder people with cardiovascular disease or with diabetes are at really high risk. It kind of makes sense. So I think another take-home message is having long COVID is not necessarily mild because they weren't admitted to hospital. And I can see Elaine agreeing with me there, because most of us weren't admitted to hospital. Most of us were turned away because there were two criteria for admission. One is you had to be blue, and the other is that you had to be unconscious. And I'm not being facetious with that. That is how it was. So a lot of very ill people were left at home and really haven't received any treatment or assessment. Just to give you a flavour of a person with long COVID, somebody that works in a hospital, not directly clinical, but I think we can forget these people are frontline as well. Not admitted, age 40. Yeah. Oh, no, I've put age 32. Actually, I think I added another case in. I've put two cases of people in the NHS here because I think these are very typical. A young nurse, age 32, a very common problem would be now that they would be dizzy and the heart rate would shoot up, get absolute palpitations just on standing up. So that even normal activities like dressing at home can be very difficult. And these people having several attempts at return to work. And I hate the word failing, but not managing. And I'll explore the reasons why. This is common. The second person was this admissions clerk who was ill at home, not admitted, initially short of breath, cough with nasty phlegm, and a bit confused. I think I was very confused in the first 3 weeks. I think I was doing some bizarre things, but that's looking back. She continued and has continued to this day, 9 months on, with fatigue, headache, severe headache, like migraine, dizziness, palpitations, and poor memory. These are very common. Severe facial pain, like trigeminal neuralgia, and low oxygen saturations, because the GPs are telling us get home oxygen monitors and check them. This is also very typical. No healthcare hasn't been able to get to see anyone. Diagnosed at 3 months with migraine and anxiety. We encouraged her to ask for a brain scan and respiratory investigations because the brain stuff wasn't normal. Diagnosed at 7 months with a cerebral vein thrombosis due to COVID. Had been told there was nothing wrong. So I won't go through these things in detail, but we talked to the World Health Organization. The patient group asked me to, and we spoke to Dr. Tedros. We didn't know he was there. We just said what I've said to you and said, look, this is really something. And at the end of the meeting, they handed over to him and we could not believe it. And he said, we hear you. We will do something about it. And he's now put this out, which he says it's a fluctuating condition with a vast spectrum of symptoms and can affect any part of the body. I'm just going to keep an eye on the time, if you don't mind, just while I have a look at that. Yeah. So I think I've said there, people have not been admitted. They've not been counted. We don't know how many people are out there with this. We just all know people, don't we? The majority weren't admitted because there was this very, very high bar for admission. People attended A&E several times, and whether they were admitted or whether they went to A&E, with these high heart rates, I can tell you, they got told it was anxiety. That's a kind of medicine I don't recognise, because I don't go straight from thinking somebody's got a heart rate of 140 to thinking it's anxiety. in the context of a pandemic. So I'll leave you to read the rest of what Dr. Tedros said. These, I think, from the work the notes we've compared on patient groups, are the commonest symptoms in long COVID, not what happens at the beginning. Chest pain. My goodness, I realized 6 months in, and it took me 6 months because I know I have normal coronaries. I realized I was getting angina, absolute classic angina. This is really common starting at 3 months for a lot of people, all ages. The palpitations and the dizziness. And you might have heard people mention brain fog. And I think you've got to ask your patients, what do you mean when you say brain fog? Because I think that's different things for different people. I always, what do you mean? But commonly people have lost their short-term memories. They're finding it difficult to take information in, and that can affect concentration and so on. Another thing is people very commonly can't find words out. That's not really reported anywhere, but you cannot find the right words, and that seems to be a thing. I had a very hoarse voice until about a week ago, and suddenly it's got better. Skin rashes, sleep disturbance, fatigue, terrible muscle aches, breathlessness, and so on, and a whole load of neurological problems. Perhaps Elaine will say more about the type of things that she's had. The strange patterns, Amalia and I said, this is like malaria, not that we've had it, but when we were at medical school, we were taught about some forms of malaria. You would get this fever every 3rd or 4th day, and then it would die down again. So we felt there was something about the virus being taken into the red blood cells and released, and in some people, they do now think it's something to do with it gets into the red blood cells and affects the oxygen transport. I've put some blogs down that we wrote because I think they're easy to read. And the one that I think Amalia was really particularly leading on was patient experiences are missing from this narrative. And we said what I'm saying now. Sorry to whiz through this, but this is just my visual of what it can be like. There are all these different patterns. Those that are feeling terrible at the start and stay feeling terrible and still haven't got better. But then there's this up and down pattern, and that's quite common. I sort of had that third line down where I was ill for the first 2 or 3 months, really bad, and then up, down, up, down, up, down, and gradually got less. I'm fairly certain that I still had virus all over the place because my last blast led to a really nasty bacterial infection. That's to do with my underlying problems. So different things in different people. Again, let's not assume one thing. So I think this is maybe all sort of stuff that you might see in your patients, or as Sue said, some of you may have had this or have relatives who do. I'll let you just look at that one. But at 3 months, I haven't put on here about the NICE guidance because it says that people don't develop any new pathology after 3 months, and that's simply not true. The new pathologies are arising all the time. So just to summarize, these are not the symptoms, but these are the actual organ problems that are being found very commonly in people with long COVID. The top 3, cardiac damage and cardiac arrhythmias. This is the commonest. The neurological, which is the brain things, and neurocognitive. And I hope these are getting better for people as time goes on, but we'll have to see. And then this biggie, which is the autonomic problems. Remember that I gave the example of the young nurse who had dizziness and palpitations standing up and actually couldn't complete a shift when she went back. What is being found is that people have POTS, so the postural tachycardia syndrome. And this is an autonomic derangement. So viruses, apparently, I heard from an expert last week, are known to trigger this autonomic reset, if you like. And in the case of COVID, it's the POTS. So they get dizzy on standing, they can't keep their the blood pressure up, so their heart rate goes sky high. And I think this is why a lot of people are failing on phased returns. The prof that was telling us about this last week said it needs slow, careful attention to all sorts of lifestyle factors and perhaps specialist physio. So I think we need to be looking at how we rehab these people. Now, I also know, I have hypermobile Ehlers-Danlos, and it's a multi-system disorder. And so I have the autonomic stuff, and I know that a lot of women in pregnancy will have these sort of autonomic POTS type disorders. So they may particularly struggle if they've also got COVID. I'm going to just briefly, I'll let you read those other symptoms. There are loads. Here's a study recently done on people who were not hospitalized in the UK, and they've scanned several organs. And in people with long COVID, this is 6, 7, 8 months down the line, 33% of their 200 patients had damage to one of the organs. Nearly 2/3 had damage to more than one organ. And you can see that the biggest group there is in the cardiac. What they say is, thankfully, these damage is mild and they hope it will improve. But I think it's kind of rebutting this story that it was all in people's heads, which is what they've been given. I'm just going to I put some pictures in. I mean, those are the facts about what I think about where we're up to with what long COVID is and how people are being affected. I'm no expert. I cannot tell you about particularly how this will affect women in pregnancy, but it might give you some food for thought and maybe to explore more. And this is just one of the pictures that I've done for Marley's book. And this one's called Doula, or is it Embodied Wisdom? I can't remember. But I love bodies, having been a healthcare professional. And I just think maternity and all of this is particularly beautiful. So I was imagining myself in that. Okay, so I think that headline is really health problems with the largest impact on their functioning. I've mentioned them already, the POTS. Mount Sinai Rehab say they are seeing patients who are more extremely deconditioned than you would expect with any other viral infection. We don't know why. As time goes on, I think a lot of people are getting better. But the other thing to say that's big, and the occupational health professor that contacted me recently said, the most troubling thing is the sense of trauma that people are displaying, not anxiety or depression, sense of trauma at not being believed. And that perhaps that's the best thing you can do for people who've had this. I believe you, tell me what's been going on. I know there's various guidance for you on COVID in pregnancy. And I'll pass over this because this is the government advice on pregnancy. Are pregnant women more at risk of getting COVID? I don't think so, but they have put them in the moderate category just in case there's a risk to women. I think that's probably a wise and sensible decision. It just says, okay, be cautious. We can't say there's absolutely no problem. I hope by the time that people have been through their pregnancies and their deliveries, they're going to have they're going to be in this position. That was actually my baby niece at 2 weeks, and me. I just felt very peaceful. And I think just a couple of minutes, really. I know I have to finish, but what do you need as midwives, perhaps, or as employees? What do you need, and what can employers do? This is a little picture from Marley's book. She asked me. She's called it receiving information. I said I did my obs and gynae job 25 years ago. This is what the labour ward office looked like then. I have no idea what it looks like now. Is it similar? No change. And you can see that people are like, yeah, I'd rather get on with my coffee. But that's hospital life, isn't it? I suggest 4 categories that you should expect to be looked after by your employees and what they can do. And I think it's this understanding, which I've said about. Not suggesting that you advise treatment, but I would like to think that you could try some treatments that work if you had these problems. That purple quote is from a psychiatry person with long COVID, and it's what I said about understanding. Validation as a subcategory of empathy is a basic human psychological need. I think that's beautiful. If you have symptoms yourself, that have carried on and on and on. There are things that can really help, and that's getting to a cardiologist or even your GP as information gets through. Beta blockers and that type of thing can help slow heart rates and have transformed people's recovery within a couple of weeks. Antihistamines, painkillers for the neurological pain, and a lot of people quite legally taking melatonin for the sleep disturbance. So there are things that you could ask your doctors about. These are dramatically helping some people. And I'll let you read through these, but occupational health services should help. What we'd say is if you're off sick, try to maintain some daily structure. They should be signposting you back to GPs and specialists for treatment. You could ask your managers, and this is not a joke, if the employer would consider funding scans and investigations if you're struggling with delays, because it costs far, far less than having people off work for months. And you're going to need long phase returns. That needs long tailored phase returns. I think I'm going to leave it there because I know that I've probably spent much more time than I should. There are other slides, but on there are these are the sort of things you should expect if you're off ill or coming back to work. And there'll be a few more things. And please feel free to raise those with your managers and human resources should you be in this situation. Thank you so much.
That's great. Thank you so much, Claire. That's really, I know there's such a lot of information, so much to share, but I think that's given a lot of information about what we can do as individuals if we've got family members or we're ill ourselves. It's very scary, I have to say, because it's not, you know, you have a cold and then you get better, you have flu and you get better. This is much more unknown, but I guess as long as people are gathering up this data, at some point we will know more.
I think people are getting treatment earlier, and I 9 months down the line feel I've turned the corner like that.
Fabulous.
So,
that's
good.
Thank goodness.
Yes.
That's great. Thank you so much, Claire, and thank you for the lovely presentation with all those lovely pictures. Love them. I'm going to have to get that book now. Okay, well, we'll move swiftly on to Elaine. Many of the viewers will know Elaine because she's presented at a couple of our festivals in the past, actually, about postnatal depression. She's a writer, an inspirational speaker, and I would say she is an inspirational speaker too. And she has talked about postnatal depression, bereavement, and overcoming challenges. So she's very skilled on that. She's also been taking part in TV and radio programs, and she's a very lively tweeter. And she has also been recovering from long COVID, and she's been sharing her experiences on Twitter, which has been very, I'm sure, very useful to people who didn't know very much about it. So without further ado, Elaine, the screen is now yours, and welcome, and thank you for coming.
Thank you, Sue, and thank you for picking up on my story as I was going along. Thank you, Claire, as well, for all that information. And I know you saw me nodding away there because there was so much that I agreed with, I've experienced. And yes, thank you for that. And I'm sure I'll be following up on those links as well. As Sue said, normally, yes, I'm a professional speaker, and pre-COVID, I certainly would describe myself as being very confident, efficient, organised, and a very busy person. I had lots of speaking engagement booked, and actually I was reflecting literally this time last year, I had been invited to be a keynote speaker over in Qatar for a major Middle Eastern conference on mental health, and I confidently did that. I'm also PA to my fiance, Mike, who's an executive coach. And also, in addition to that, I do an online bookkeeping job. And just to fill in the other gaps, I work part-time at our local convenience store, and I'm now shift manager 3 times a week. So that was me pre-COVID, here, there, and everywhere. Then lockdown started. Of course, overnight, all of my speaking engagements vanished. Mike's work also went. And yet, wow, at the store, we were so busy. This was in the days of no pasta, no toilet rolls, and the local corner shop really became into its own. So we were, the company looked for friends and family to work in the shop as well. So Mike joined me, and both of us, for most of March and April, we were both behind the till and keeping the local village going, really. 20th of April dawned, and both of us began with symptoms of COVID. From being so busy and everything seemed to be going all right, being proud that we were contributing as key workers, that was it. We then, both of us, succumbed to a horrendous cough, the fever, aches, pains, earache, headache, exhausted, and almost like an octopus on roller skates. The symptoms seemed to come and go and change so much. Breathing was a challenge, and that's when I started to tweet, and literally I'd just do a very short film just to say to people, look, this is a real illness, please be careful out there. We were at the point that even literally going to the bathroom was too much effort. After about 2 weeks, Mike was admitted to hospital because he'd developed a secondary infection whereby he couldn't literally walk. He'd got an inner ear infection. And the night that the ambulance men came and took him away was one of the lowest points of my life, because at that point you were hearing of the stories of people going into hospital and never coming out. And I remember the paramedics looking at me and commenting on how poorly I looked, and it looked like I should be going. But as Claire said, not everybody was going. Thankfully, 3 days later, he returned. And then it became the summer and autumn of the dressing gown. And that's okay. We literally seemed to manage from then support from the GP. Our family was great. We had our neighbour Steph, who delightfully left us gorgeous cakes on the doorstep for us, and other family and friends offered support, and of course each other. We were very much looking forward to getting married in September. Yet the days of illness became weeks, and the weeks became months. We had to make the heartbreaking decision to postpone our wedding, which was planned for the 26th of September, because neither of us were well enough to do the planning, let alone enjoy it. And like the rest of the country, the world, holidays were cancelled and all the celebrations in life. And of course, work ceased. The impact, as we realised that we were amongst the people then described as having long COVID, I agree with Claire very much. They are unique. And for me, I would say my mind, my body and my spirit have been impacted. My mind, since my postnatal period where I did ultimately develop puerperal psychosis, my mental health has been great, absolutely. And even when I lost my partner coming up for 10 years ago now, that period of grief, even then my mental health was still okay. Yet during long COVID, I've become overwhelmed with just everyday tasks. The anxiety I've witnessed is something that I've never experienced before. My confidence has been completely sapped. When I think of, say this time last year in front of 800 people, now I'm back to just 1 or 2 people. I can find it to be quite a challenge. I just really want to stay under the duvet. And yes, and again, as Claire mentioned, the sleep issues, my sleep has been diabolical. My body, everything just seems to be an effort. I just have still the lack of energy, and my usual zest for life just seems really to evaporated. And even now, I think you can hear as I'm speaking, I do still get quite breathless. Yesterday, day before, I literally walked about 7 minutes it is to the post office, and I had to stop on the way back because I was still having to gasp for breath. And my spirit, I feel partially I've lost myself again. I think as well there's an element of guilt there, that you see the heartbreaking headlines, the figures now over 60,000 people who are no longer here. And you feel that sense of guilt that you should be grateful because you still are. There's that sense of shame that you feel people will be thinking, oh, for goodness sake, by now she should be better. Get over it. Boris was back, out of intensive care within weeks, back running the country, all of these things. And I think the underlying thing that I still feel is a real sense of apathy. And I'm not usually the sort of person who thinks, can't be bothered. And yet so often at the moment, I feel like that. My blogging stopped because can't be bothered. But ultimately, I know one of the key messages I've always shared over the years as I've spoken and in my writing, I always have stressed the importance you have to look after yourself first so that you can look after other people. And this is one of the first things I've actually done about this, other than my little clips that I had put out, because I feel just maybe, yes, there is improvement. And as time goes on, I will write about it more, and I want to speak about it. So where am I now? Well, about 3-4 weeks ago, I did start back at the shop on a phased return. Officially, I'm not classed anymore as being ill. I have no sick note, and yet I'm not fully recovered. So this is why I would be prepared to speak more about this and to look into ways that you can make it easier for people. Because financially, I had to make an effort and start back at the shop. So what's helped me though? Because I am definitely improving. I was lucky enough to win a competition run by Cheshire Life magazine, which I think the strapline was, "What have you done to improve your health and well-being during lockdown?" And my reply was, "I've worn my dressing gown and not been out." And I won a full makeover. I got a very nice photo shoot and a beautiful new coat, which I still haven't been able to wear. It's in the cupboard with the red shoes. And but the best part of it was a nutrition and movement program called My Time for Change. And I literally had daily support through nutrition and a very short exercise clip. And it's been incredible. I've lost a dress size. Mike has gone down about 2 suit sizes, and that wasn't the aim. What has happened though was the fact I wanted to be educated to how could we fuel our bodies? How could we heal it? And even though I've finished officially that program, we're still using it. And it's a great day when I hear Mike say, "Oh, I've missed a salad the last few days." So that has been a great change, and I would recommend that. I'm aware that sleep is a vulnerable point for me, and I know that becoming so ill postnatally, one of the key things then was the fact that it was sleep deprivation. So I've been very aware of what can I do in this situation, and I have a very good friend who is a hypnotherapist, and he very kindly has sent me one of his programs, and I think I'm month 2 into that, and again, it's improving. I do recommend a phased return to work. I'm not ready for the responsibility yet. I do find the brain fog that Claire mentioned. Yeah, I mean, I put some washing on the other day and then realised why was the kitchen warm, and I realised I'd put this on to dry, not to wash. I went and bought some wool the other day, and I was waving my phone over the ball of wool on the counter thinking, why isn't my contactless working? And I realised that no, a ball of wool doesn't do that. You have to move the phone over to the machine. They're just as bizarre is the right word. They just really are dozy things. I think it's great as well to make space for fun and silliness. We'd planned our wedding the second time for the 14th of November, all going well. 2 weeks before we got the second lockdown. And again, we had to cancel or postpone our wedding. So we marked the 14th of November by having a barbecue in our courtyard at night when it was cold, playing loud music that we'd actually identified for the wedding, had quite a bit to drink, and yeah, had a fantastic night. We really did. And we decided to make a different memory out of, instead of sitting there thinking, oh, this would have been happening. We had a fabulous night. So I'm all for fun and silliness. I think there's a great comfort knowing that you're not alone. And that was why I shared my story of perinatal mental health, because I know through the many people telling me that hearing my story has helped them. And I sincerely hope by sharing this, it's helping somebody. And the other thing I've begun to do, my best friend Sue reminded me, Elaine, pick up your knitting needles again. You enjoy knitting. Yeah, for many months again, can't be bothered. And that little encouragement by Sue led to me now a new little business. I'm now creating and have been selling Barbie clothes online. And I find that by sitting knitting while I am watching Tipping Point or whatever else, at least I feel I'm being productive. So part of the older me is emerging of always wanting to be busy and always being constructive with things. And it's also, I know it's a form of mindfulness, because while I'm thinking knit one, purl one, cast on three, etc., my brain has just for a moment stopped with all these thoughts about what could be, should be, why can't on, all of that stuff. It just can stop. So the future. We know this will pass, and that we can hopefully in the new year begin to start making proper plans again and meeting people properly. I look forward to being back on real platforms again. And Mike and I have even discussed as a married couple, hopefully, that we would love to do joint presentations. It would be wonderful to wear nice clothes again, starting with my wedding dress. Everything is crossed for the 30th of January. Please, third time round, let's be lucky. So my final tips for everybody, and I'm aware this was for you as midwives and student midwives, but I hope, I was asked to share my story and as a generic example of what can happen. I think for all of us, we need to be patient, we need to be kind, we need to be understanding and have a non-judgmental approach. And that applies to ourselves, first and foremost, and to others. If you need support, ask for it and be gracious for it. If someone does kindly offer to make you a spaghetti bolognese, does it really matter if it's not whole wheat pasta? No, enjoy it and be grateful. And if you see someone or are aware of someone struggling with long COVID, ask them, what do they need? What would they find helpful? And it might just be a very basic thing. Just ask. And finally, the way that I'm getting through is a bit like they say people running a marathon. You don't need to run 26 miles. You do it a mile at a time and break it down one step in front of the other. So at the moment, I encourage us all to focus on now, when the future is still a little bit unknown, and respond to the mood and the moment. And I sincerely hope I won't be having another barbecue on the 30th of January. Thank you.
Thank you so much. That was fantastic, Elaine. And I think your points about being patient, kindness and judgmental, especially for self, I think in the context of long COVID appears to be a big thing, because I think, and Claire raised about, and it has remembrances of when people used to start talking about ME as being yuppie flu, with a sort of almost it wasn't real, it wasn't important. And one of the biggest things was finding for people who have it is acknowledging that it is real and they need support and care. And I think this has come over very, very strongly from both of your presentations. So thank you very, very much for sharing that. I think it makes me feel very humble to think what you've both been through, and you're coming out and being so positive and very inspirational, the pair of you. Thank you very much for that.
Thank you.
Almost like two twins here.
And you know what? We didn't. I keep looking at Elaine and thinking, oh my God, her features are like mine, her hair's all. But we didn't plan that we were going to say those things. We actually didn't know what each other was going to say, did we? About those?
No. And well, now we have a little time for questions. So thank you everybody for watching and sending questions. We've had lots and lots of lovely comments to both Claire and Elaine saying how much they've found it very useful and enjoyable. And we have a question from Christine. Hi, Christine. And I'm looking over here because I have two screens. And one screen comes the questions, and it says, Christine says, is long COVID clearly diagnosed, or can it be confused with any other illness? Which I think Claire alluded to. I don't know if you'd like to take that, Claire.
I don't think it is one clear thing. I think the best that we can say is it describes how long something has lasted, for the reasons that I think it's a very complex illness. It's an infection of the blood vessels, so it goes wherever the blood goes. So and then some people with good immune systems will fight it off very easily. Others, like there's quite a lot of people with hypermobile Ehlers-Danlos, we have coexistent exaggerated immune reactions. It's just so individual. It's so, but I think what's going to happen is that not one thing predominates. Some people will have ongoing virus, others will not, others will have inflammatory conditions that are triggered and then settle. I just think it's a whole mixture. So no, I don't think we can say it is a thing. And I think there is that is confusing about how it's reported. But I do think our doctors need to catch up with things a bit in the country and sort of, yeah. I
suppose there's been such a focus on the kind of acute COVID without understanding fully the other kind of iterations of it.
Yeah.
No, that's grand. Thank you. And we have a question from Celine, who says, you say that long COVID can be considered one day as part of chronic disease?
No, what I meant was that Trisha Greenall had written about it in terms of timescale, and I think that's a perfectly accurate way of doing it. And people are arguing over what it's called. In the literal sense, it is chronic, i.e., it's been long term. I don't think we know enough yet. It's only been around a year or so as to whether it will be. You know, whether things will last. I think in some people it triggers things that are autoimmune. Whether these will settle or not, we don't know. Whether people will become undiabetic, I don't know. You know.
No, that's grand.
Hopefully for most people it will have a conclusion.
Okay, thank you for that. Now we have Edith K. Hi, Edith says, is in terms of the risk of I think postnatal depression, should we as midwives routinely giving advice specifically on this in relation to COVID, i.e. prior discharges and during home visits? I'm assuming that, Edith, you're talking about long COVID being a risk. I'm not quite sure on the question, actually, having started that question. That sounds a little bit confusing, I think, in terms of postnatal depression. Because I think you'd have views on postnatal depression, wouldn't you, Elaine? Perhaps you'd like to.
I was going to say, I think any situation in life where you have potentially two very vulnerable areas, I would suggest that any pregnant lady or newly delivered baby mother who either herself has had COVID or long COVID or has a close supporter, her partner, her parent, for example, with long COVID, that they should be almost put on a watching or be aware of the fact that that could impact even more. Because if I was going through this now at the same time as having a new baby, where you have all of the high risk factors for the mental health problems anyway, as we know, a professional lady who's had a baby a bit later, who wants everything just so, and all the lists, etc., are there, that throw this in as well with the mind and spirit things I've been talking about. Wow, yes, to me, you are really adding fuel to that fire. You really are. So it is about being aware. And also, if that new mum has got her own mum who's not well and isn't able to give the support that normally they would do, again, we need to find the support and encourage them for them somewhere else.
I think that illustrates, actually, Elaine, beautifully the kind of the complexity that we have to deal with in making sure that women are aware of symptoms, for example, of long COVID and postnatal depression. I hope, Edith, that's what you were seeking, because I think Elaine gave a very good response. That was really useful. Thank you. And then Celine comes back now and says, what would be your one message for midwives going forward?
I would say it still is look after yourself first so that you can look after others.
Yeah.
And Claire's nodding away.
Well, that's what I've always said, and that's just so right, because I've always said that in occupational medicine, and I think if we're in caring roles, you have to, and I taught it in life anyway. You know, you're no good to anyone else unless you really are. It's keeping a balance, isn't it? I think it's keeping a balance, really. Yeah.
And that was a good question, Celine. So I think it's one of the difficulties because of being in a health profession anyway, and as women, we're very often, there's a women-dominated profession. We're often balancing lots of different things and caring as well as working, and to look after ourselves is really important. And I'm going to repeat, being patient and kind and non-judgmental to self. I think that's a wonderful way to finish. And I'd like to say a big thank you to Claire and to Elaine. We could carry on for another hour easily, and I think there are some questions coming through, so Claire and Elaine might be able to answer some of these questions afterwards.
Of course.
And I'm
very happy to.
And I'd like to say a big thank you, and thank you to everyone who's dialed in, that's a very old-fashioned term, who's observed, come to watch the presentation. Thank you so much. Some of us will be on the social media answering some questions. Some of the questions, I have to say, which have come through, which are brilliant questions, of course, because of the nature of COVID and long COVID, we don't necessarily know all the answers to, but we'll try to answer some of them. There are resources available on the website and on and this whole presentation will be available by Friday. Now, next week, completely change of scene, we're going to be looking at reverse mentorship with Dr. Jim Thornton and Rebecca Dewey. So come in at 7 o'clock next Wednesday for that. If you're doing forward planning, we have our festival on the 13th of January 2021. Can you believe it? That's online. We've got Professor Jacqueline Dunkley-Bent as a keynote, and there are some fantastic presentations. So do check out the website for that. And All Ireland Festival will be on the 9th of February also. And in the meantime, I'd just like to say thank you to our speakers. Thank you to you. Keep well, look after yourselves as well as your loved ones. Give them all a hug. I'm sending you all a little virtual hug anyway, and a virtual hug to Claire and Elaine, who've been so generous with their information, their time. So thank you and good night.
Thank you very much.
Midwives, doctors, nurses, everybody.